There are no best practices, no SOPs, no formal diagnoses. Prenatal opioid exposure has been impacting children in this country for the past 2 decades, yet we have been painfully slow to create a supportive place for them to land. We've done a lot for those struggling with opioid use disorder, but what about the children born exposed to these drugs? We know about NAS and withdrawal, and we're finally starting to have more productive discussions about how to help babies not just survive that experience, but minimize their trauma and truly support a healthy transition into infancy. But what happens after that? These kids bounce from pediatrician to specialist to therapist to teacher, while caregivers tread water, trying desperately to understand their child's unique needs and how to support them. Oftentimes, they were sent home from the hospital with their newborn, bid a swift congratulations, and given zero warning about what long-term effects might arise in their child and how they might support them. These caregivers often feel blindsided, guilty for not knowing they could seek interventions to possibly mitigate some of their child's challenges sooner, adrift in a sea of online support groups, scouring research studies that are outside of their ability to comprehend, and really lost and invisible to the rest of the world, who seem to only be focused on adults with opioid use disorder at the detriment of these invisible children. Generation O exists to support children and families impacted by the opioid epidemic and to raise national awareness of the long-term impacts of prenatal opioid exposure. We intend to change the future for these kids, and we insist that healthcare professionals, educators, therapists, and researchers come together to strengthen and tailor their support systems for these kids. That's why we created OPIOIDEx. OPIOIDex is a quarterly virtual information and resource exchange focused on aligning industries to improve outcomes for opioid-exposed children. Sessions are separated by areas like healthcare, research, and education. You'll have the opportunity to interact with peers within your industry, share research, therapeutic techniques, ask questions, share observations, find overlaps, and innovate together to create a better future for opioid-exposed children. This is vital and meaningful work. We hope you'll join us for OPIOIDex.